called In Treatment, where the therapist there is quite human and quite revealing. I like that. I like the way that he's presented in the first few versions of that show.
I was a little skeptical of that show, but I've gotten into it, and I think it actually presents things pretty well.
Yeah.
And Gabriel Byrne is a fine actor. I mean, he's doing. Because I keep comparing him to Dr. Malfi, Lorraine Bracco in The Sopranos, and you can't help it. It's a different kind of representation.
I disliked her view of therapy very much, and there was something extremely inauthentic about that. Television and mass media has not done well with psychotherapists. The only one that I've enjoyed before this show was Robin Williams in Good Will Hunting. There's a therapist I would have been glad to visit as a patient.
Because he was compassionate and loving.
That's
really.
right, exactly, and real.
Son, Overcoming the Terror of Death, and he'll be at Kepler's Wednesday night in San Francisco at 7 p.m. He's with us now. We're going to go to your calls, and let's do that right away. Marv, good morning.
Morning.
Yes, sir, you're on the air.
I would like the doctor to comment on the movie 2001, because I don't see that movie as a futuristic kind of space travel movie. I see it as a commentary on birth and death. If you look at it from its beginning to its end, it's that's the way I see it.
This is Kubrick's film. I didn't know we were doing film analysis, so you don't know the film.
Oh, wow. I saw the film, but I don't remember it well enough to think of. Tell me a little bit more about what you had in mind about the film that pertains to this topic.
Good therapist question.
It was a wonderful film, but I don't remember. How does it relate here?
Well, the movie starts out as at the beginning of time and the beginning of humanity, and then it ends up with a futuristic space travel, and the hero of the movie, lying on a bed as a very, very, very old man, and obviously going through the throes of death, even though no words are spoken in those final scenes, he knocks a glass of wine off the table and stares at the broken glass on the table, on the floor, and then the next scene he's seen lying in bed, and then the final scene he's going off through space, but back in the womb. It's a picture of a child in a womb in its initial stages of development. So
let me just say a couple of free associations I have to that. And of course the picture does end with the whole issue of a new kind of shall we call it life? With the robot beginning to
artificial intelligence.
Yeah, artificial intelligence beginning to take over, and of course that's been a theme of a lot of science fiction. The Hyperion kind of trilogy really does illustrate that as well. The other thing you're talking about is which is very interesting point that you're making about the going back to the womb. This is a little bit of a loose association, but let me tell you about something I wrote about, which is a very, very old argument going back to 350 BC. It's one of Epicurus's major arguments as a way. He felt, Epicurus was a Greek philosopher who felt that the job of philosophy was to alleviate the despair of human beings, and all despair, he felt, issued from the fear of death. And one of the arguments he's given, and it is still current, I use it in therapy very often, is the idea that when we pass on, when we move into, if we can call this a state of non-being, it's really identical to the state of non-being we were in before the womb, before our birth.
But only Beckett remembers being in the womb. As far as I know.
That's
actually,
right.
Here's an email that kind of dovetails. Dr. Yalom, death anxiety often arises in therapy sessions with my clients, and usually in the form of visceral experiences of existential nothingness and emptiness. I welcome it, and often find the deepest, most transformative work happens in the presence of discovery of emptiness. And she goes on to say, you've been a source of great wisdom for me as a therapist. So there's your existential hooking away. I mean, when you discover this emptiness, when you know you're up at the top of the mountain like Sisyphus, and
right.
you have that moment of clarity or whatever it is.
Yeah, exactly. When you really do sense, one of the existential tenets really is that you're thrown, is Heidegger's term, you're thrown alone into the world, and you have to exit alone, and you can't take anyone with you either. There is a certain kind of isolation, which is I think of as existential isolation. It's not the typical form of isolation we talk about, which is cured by social interaction. It's something that undercuts that isolation that can't be bridged. You know, one of my patients that
Can you go back to Heidegger for just a moment?
Sure.
Because you make the I don't want to get too much into Heidegger here.
Yeah.
Let's Nazi that he was, but no, you make the distinction between he makes the distinction between the everyday and the ontological, and you point out that distinction as an important one for us to understand.
Yeah, it's something that is a very important concept. To put it in, I think, the most graphic terms, he makes a distinction between two states of being. There's the everydayness state of being, in which we're preoccupied with things around us, we're distracted by things, but then every once in a while, and we wonder about how things are in the world. In other words, how things are about us, the nature of things. But there's another state of being. He calls this ontological state of being. Ontological simply means the study of being. But it's a state of being in which we wonder and marvel that things are, rather than how things are. You see the difference? There are things that things exist at all in the universe.
It's like I, it, and I, thou, in a way.
That's right. Yeah, I think it is. And so when we get into the state of that things are, we're in a state of mind where we're thinking more deeply about existence itself. And what's really important for therapists in that, when people are in that state of mind, then they're much more apt and prone to make changes. That was the state of mind that I talked about that some of my patients with cancer got into. And so they began to trivialize all these trivia around them. One person told me that cancer cures psychoneurosis, you know, that the changes can be made then that are very rapid. So my job as a therapist is, how do we propel one from that state of everydayness to that state of mindfulness of being itself? And that's why I take advantage of things like dreams or brief encounters with death. And very importantly also, the death of others. You know, we know a lot about grief and mourning, and we know a lot about loss and detaching ourselves gradually from the lost one so that we can begin to use our energies to begin to make new attachments. But there's an important part of mourning that we often overlook, which is that the death of the other brings us into confrontation with our own death. So I think when I work with people who are in grief, I try to take a look at this new encounter they have with their own death. All of this is a way of moving into what you're talking about, of Heidegger's state of the ontological state of awareness of being.
Bonnie, join us. You're on the air on Forum. Good morning.
Good morning. Hi.
Hi.
Can you hear me?
Yeah, we can hear you fine. Go ahead.
Great. Yes, I'm fascinated by this conversation. I read Stephen Levine's book 10 years ago, A Year to Live, and was so inspired by it that I started a group of all women at that time to really look at living with death as a guide. Since then, I've led 50-something groups through a year-long process, and I also give day-long workshops called Living Mindfully Now. 2 months ago, I was diagnosed with breast cancer, and does it put it right up front? The gift of living, like for a while, I lived with a glow-in-the-dark skeleton skull in my bedroom to remind me if I woke up in the middle of the night that I was going to die. So having 10 years practice of really looking at this just gets me closer to the wow of
Makes
life.
every night Halloween, actually, doesn't it?
Yeah. But this death being close without ever calling it to us, brings up every friendship I've had, everything that needs cleaning up, and just lets me to be more free. And right in the middle of medical treatment, it keeps letting me come back to that place that you mentioned before of being, that right now I'm alive, right now I'm here, right now I'm happy.
You mentioned the mindfulness here, and of course
Yes.
I often associate that with Buddhism too. I mean, as a practice.
Yes.
Irvin Yalom, how important is it to keep death in our minds? I mean, particularly for people who aren't necessarily experiencing the terror of it or plagued by the terror of it.
Well, we can't stay in that white heat all the time, but I think as a background,